Hi, I'm Kirsten Cross. The Chief Public Health Officer's Executive Summary on the State of Public Health in Canada in 2010 discusses the overall health of Canadian seniors. In 2008, seniors were nearly 1/7 of the Canadian population and is expected to grow to nearly 1/3 of the Canadian population by 2050. This summary highlights a strong focus on building a healthy aging environment, examining the causes of death, looking at outside factors such as the social determinants of health, addressing the main areas of concern and areas that need to be improved. These reports were created to oversee how the general health of seniors has improved over the past 3 years and to see what can be improved or prevented for the future.
The 2010 Chief Public Health Officer's Report focuses primarily on the well-being of Canada's seniors, and more specifically, falls, mental health, abuse, and care services. Due to the aging Canadian population, it is evident that the healthy aging process is of immense importance. This mainly involves optimizing opportunities to improve all aspects of health. In addition, current factors as well as earlier experience in life are taken into consideration, as it is shown that both of these types of events have an effect on the well-being of seniors. The article then discusses how some of the programs implemented to improve seniors' health have been effective and also outlines potential areas of improvement. In addition, the article outlines how the aging population is growing rapidly and some of the health concerns that must be addressed because of this. A major health concern facing the aging population is falls, and much of the article discusses the negative health outcomes related to this. One of the last sections of the article outlines conditions for healthy aging, specifically the success rates of what has been done and how that can be continued or improved on in years to come. The last section of the article gives advice towards healthy aging, which, if implemented, could potentially greatly improve the quality of life for many seniors.
This is C.R. Simpson discussing the Lalonde Report from 1974 that focused on 4 key components of health: human biology, environment, lifestyle, and healthcare organization. This report was the first stage of health promotion in Canada and led to the beneficial promotional programs that focused primarily on educating society about the 4 determinants. The Chief Public Health Officer's report in 2010 also discussed the importance of promotional programs, but with focus on fall prevention in seniors. In both cases, programs are implemented to educate populations on how to improve their health and exhibit healthy promoting behaviors. This is C.R. Simpson discussing the Alma Ata Declaration in 1978, which expressed the importance of protecting and promoting health, and redefined key areas that needed focus or attention, such as inequalities, economic or social development, participation in health, and many others. However, the main focus was on the concept of primary health care, which gave individuals universal access to the health system and demonstrated a communal approach to health organization. Consequently, the Chief Public Health Officer's report in 2010 outlined actions and key concepts regarding healthy aging of seniors, including exercise programs, age-friendly communities, and having basic needs met. In both cases, a plan is created with key areas to focus on in order to benefit the health of a population, whether it be with the primary healthcare model or healthy aging seniors.
Hi, my name is Taylor Longmire, and I focused on both the EP report and the Ottawa Charter for Health Promotion. The EP report was created in 1986, and the main focus is health for all. It proposes an approach to help with the current health challenges many Canadians are facing. The challenges outlined are reducing inequities, increasing the prevention effort, and enhancing people's capacity to cope. It then outlines health promotion strategies to help solve these challenges, such as encouraging public participation in order for them to have control over their health. This report relates to the Chief Public Health Officer's report in 2010, since they both focus on the prevention of injuries, falls, illness, and chronic conditions, as well as improving the mental health and care services. The EP report also mentions the considerable rise in the aging population and thus the rise in chronic conditions and disabilities. Therefore, the need for health promotion strategies. The EP report delineates from the officer's report as it does not primarily focus on the well-being of seniors, it focuses on the well-being of all ages. The Ottawa Charter was also created in 1986 and encourages a lot of what was outlined in the EP report, but it also puts a focus on the determinants of health and outlines 5 key actions for health promotion. It is believed that everyone should have equal opportunities in order for them to achieve their fullest health potential. The Ottawa Charter relates to the 2010 Officer's Report, as they both focus on improving the health of individuals, but the Ottawa Charter does not focus solely on the health of Canadians, but the health and needs of all individuals.
Hi, this is Jan, and I will be talking about the Jakarta Declaration and the Bangkok Charter for Health Promotion in a Globalized World. The main objective of the Jakarta Declaration is to increase life expectancy through health promotion. It has identified several determinants that impact the health of an individual, some of which are listed on the slide. The 2010 report focuses on the elderly and the healthy aging process. The main concerns regarding seniors are comparable to the determinants mentioned in the Jakarta Declaration. 2 areas of action written in the report pertain to meeting the unique needs of the elderly and appreciating their role. Similarly, the Declaration has set 5 priorities that strengthen health promotion to empower individuals. The Bangkok Charter is about centering health in a fast-changing environment. Working conditions, learning environments, and other aspects of the community are influenced by social, economic, and demographic changes. Creating good workplace practices is important for maintaining the well-being of employees. The 2010 report mentions that earlier life experiences can shape the future well-being of a senior. This includes working conditions. It was also pointed out that investments must be made in sustainable policies, actions, and infrastructure to deal with the determinants of health. Having a safe and supportive environment is important to the aging population. The conference also established 4 key commitments for health promotion as listed on the slide.
I'm Miriam, and the Canada Health Act was created in order to provide equal and accessible health care to Canadian citizens through hospital insurances. This act has set 5 criteria for healthcare in Canada, which are public administration, comprehensive care, universality, portability, and accessibility. Relating this back to the report, the Chief Officer recognizes that the services offered to seniors plays an important role in aging. Interestingly enough, the report recognizes that seniors are unable to access particular services. The report suggests that we expand the number of services provided, such as the ones listed. The Canada Health Act states that individuals must receive reasonable access to care, and this care should be ensured. This aligns well with the report, as both recognize the importance of accessibility in determining the health of not only seniors, but all Canadians. The report also recognizes the financial barriers that many seniors face when purchasing necessities, such as drugs. This confirms with the Canada Health Act, as it recognizes that barriers to access influence health negatively, and further action should be taken in order to remove these barriers and promote care to all citizens.
Kirsten Cross again. In conclusion, the seniors in Canada were considered to be generally healthy in 2010. In order to progress further, there will need to be collaboration between local and provincial public health agencies to implement the areas of action suggested in the report. Incorporating a stronger effort into primary prevention and determining what can be done earlier in their life is the key to living a healthy life as a senior.